Welcome, everyone. I'm Carlie, nurse practitioner and clinical director of Flora Aesthetics and Wellness, and we're so excited to have you here for our virtual hair restoration event featuring Alma TED. If you've been struggling with thinning hair or hair loss, you're in the right place. Today, we're going to cover the common causes of hair loss, how Alma TED works, and what kind of results you can expect. I'll be sharing pre-recorded educational content, and afterwards, my team, Morgan, Lauren, and Anna, will be here live to answer all of your questions in real time. Stay with us until the end for the live Q&A where you can get all of your questions answered anonymously. Plus, we're offering exclusive event-only specials and we'll be announcing our giveaway winners via email after the event. Let's dive in. So what causes hair thinning and hair loss? Hair loss can be frustrating, but you're not alone. I've dealt with it myself. Some of the most common causes include genetics. So if you have a family member who's had hair loss, you might be prone to it too. Hormonal changes like pregnancy, menopause, and thyroid imbalances. And stress and lifestyle. So high stress, poor diet, and even certain medications can impact your hair growth. There's also the scalp health. So inflammation, whether it's from a medical condition of your scalp or just general inflammation in the body, poor circulation, and buildup can make it a lot harder for that hair to grow. In some cases, underlying medical conditions can contribute to hair loss, such as low ferritin, so that's a type of iron deficiency, or high testosterone levels. That's why it's not a bad idea to have a workup with your primary care provider to rule out any internal causes before you begin treatment. But the good news, TED works on most types of hair loss. As long as there's still hair follicles present, it's going to work. It's not effective for conditions like alopecia areata or scarring alopecia where the follicle has been permanently damaged, or if you're shiny bald. If you've lost hair due to chemotherapy or other cancer treatments, we'll need clearance from your oncologist before starting treatment. Additionally, TED is not recommended for individuals with metal implants in the treatment area or cochlear implants, as the ultrasound technology could interfere with these devices. For everyone else, TED offers a non-invasive, pain-free way to stimulate your scalp and promote thicker, healthier hair growth without downtime. So how does TED work? Alma TED is a cutting-edge hair restoration treatment that uses ultrasound waves and air pressure to deliver powerful growth factors deep into the scalp without needles or pain. Think of the first pass of the device as gently vibrating your scalp, creating tiny temporary openings between the skin cells. The second pass then pushes the growth factors through these pathways, allowing them to penetrate deeply and activate the natural processes needed for stronger, healthier hair growth. Unlike treatments like PRP, which require needles to inject growth factors, Alma TED effortlessly delivers them through the skin using sound waves and air pressure alone, making the experience completely painless. The best part, no pain, no downtime, and no shedding phase, just real results. So what's in the Alma TED topical serum? The Alma TED treatment uses proprietary growth serum packed with essential nutrients, peptides, and growth factors to nourish and strengthen your hair follicles. These ingredients stimulate new hair growth, reduce shedding, and improve hair density, leading to fuller, thicker, and healthier hair over time. Okay, now my favorite part to talk about. What are you going to expect after doing treatment? So immediately after treatment, your scalp could feel kind of tingly or warm, but there's no downtime. The serum that's applied to the scalp dries, and you can return to your normal routine right away. In the time after your first treatment before the second, most patients are going to notice a decrease in their shedding. So for women, that means less hair on the shower wall. For men, maybe not as much, like you don't notice it as much because that shedding isn't as obvious, but the hair is going to start to feel stronger. After treatment 2, you're going to start seeing some of those baby hairs popping up into the areas of thinning. Hair shedding continues to slow, and your existing hair might start to feel denser. After treatment 3, you're going to start noticeably feeling that the scalp hair or the hair at the scalp is feeling thicker. You're going to continue to see improvements as new, thicker hair grows in and blends in with the rest of your hair. Because hair grows slowly, you're going to expect ongoing results over the next months after the follicles continue to strengthen and fill in. Some patients, especially those with more significant hair loss or thinning, choose to do additional treatments beyond the initial series of 3 to really get those optimal results. After the initial treatments, maintenance sessions, once or twice a year, will help to sustain and enhance your results. We're finding most patients want to do a treatment every 3 to 6 months just to really upkeep what they have because they're afraid of losing it.
Hi, I'm Morgan. I'm one of the nurses from Flora Aesthetics Wellness. And today I have Maribel. Maribel is here for the Alma TED hair restoration treatment. Maribel, what made you decide to come in for this treatment?
I have PCOS and I had a baby about 2 years ago, and that's when I really started seeing my hair falling out, getting really thin. I was really concerned, so I was really interested in this treatment.
Wonderful. Where do you notice most of the thinning on your hair?
Mostly my crown area, around my temples.
Mm-hmm. Yeah, very common, especially after baby.
Yeah.
Okay. And so with Alma TED, we're going to be using this handpiece to open up the between the skin to push the serum through. So we're gonna kind of open them up like tectonic plates. So we shift those plates apart. We deliver the serum. The serum is formulated, it has about 100 ingredients on all to nourish the scalp, your hair health, and to promote you retaining the hair that you do have. So once the serum is applied, then we go back over the same area and we push the serum into those tectonic plates that we just opened up and close them. The treatment is pain-free, actually pretty relaxing.
Thank you for joining our virtual hair restoration event. We hope you learned how Alma TED can help you restore thicker, healthier hair without pain or downtime. As a special event-only offer, you can start your healthy hair journey with 3 Alma TED treatments for $2,100. This is regularly $3,200. And it includes 3 months of free Express hair vitamins to support your results. There are limited spots available, so text or call now to claim your offer. Keep an eye on your email tomorrow as we'll be announcing all those giveaway winners via email. Now, for the next 15 to 20 minutes, Morgan, Lauren, and Anna will be answering more questions live in the chat. So drop your questions. Keep in mind, they're all anonymous. We can't wait to help you achieve your hair goals with Alma TED.